Wang from China, Director and Vice President of the Eye Center of Beijing Hospital, President of the Asia Pacific Academy of Ophthalmology, and the Chinese Association of Ophthalmologists. And our colleague will speak about different forms of glaucoma. Are the approaches to hypotensive treatment the same?
Today, I would like to give a talk about the normal tension glaucoma, what we know and what we don't know. I'm Dr. Wang from the Beijing Tongren Eye Center. About the normal tension glaucoma, that is a higher prevalence in the Asia country, especially in the East Asia. One study from the China, Handan. This study is a population-based study. This study discovered the prevalence of the ratios of the normal tension glaucoma is quite high. It's about the 83% of the open-angle glaucoma is the normal tension glaucoma. So this ratio is as higher as the result from the Japan and South Korea. So again, we got the evidence in China. Also, we have quite a higher proportions of the normal tension glaucoma among the open-angle glaucoma in China. Now, let's see the prevalence of the normal tension glaucoma among the different races. Just like in the Caucasian, the normal tension glaucoma, the ratios, the proportions about the 40, but in the African it's almost 60%. Especially in the East Asia, the proportion of the normal tension glaucoma reach above the 80%. So when we back to the hospital, there is a hospital-based studies show in the hospital the normal tension glaucoma, the proportions is quite lower. Some studies from Hong Kong, United States, and from our hospitals, the normal tension glaucoma, the proportion of the normal tension glaucoma in the hospital-based studies is around 10 to 20%. So that is quite a difference. Why there is a difference between the population-based study and hospital-based studies? This means the most of the normal tension glaucoma did not detected among the general population. So here is another question. Because the normal tension glaucoma is quite hard to diagnose because there is the different ocular disease maybe can be misdiagnosed as a normal tension glaucoma. So there may be some contributions from the misdiagnosis of the normal tension glaucoma contributed to the higher proportion of the normal tension glaucoma, even though the normal tension glaucoma still is a higher proportion among the open-angle glaucoma. Now I would like to discuss another possibility factors that maybe can affect the proportions of the normal tension glaucoma due to the statistics misleadings. So there is more and more investigations from the Asia country. We found about the cutoff of the intraocular pressure value. Maybe it's a difference between the Caucasians, the African, and the Chinese. And most probably in the Asia people, we have a lower cutoff value of the intraocular pressures. Let's see. If the cutoff of the value, the clinical decision limits, or maybe we can call the reference interval, like is around the 19 millimeter accuracy, or we have overdiagnosed of the normal tension glaucoma come to the 20%. If that is true, but still in the Asia countries, in Chinese, in the East Asia, we still have a higher proportion of the normal tension glaucoma among the open angle glaucoma. And from the very beginning, I mentioned the normal tension glaucoma's diagnosis is quite difficult because there is many different ocular disease or maybe systemic disease can mimic the phenomena, the symptoms, signs of the normal tension glaucoma. Let's see. The Leber's hereditary optic neuropathies sometimes maybe can be misdiagnosed as a normal tension glaucoma. And compressive optic neuropathies maybe can be misdiagnosed as a normal tension glaucoma. And anterior ischemia optic neuropathy, even the most prevalent disease, higher myopia, can cause a higher proportions of the misdiagnosis in normal tension glaucoma diagnosis. And from the systemic disease, we found the vitamin B12 deficiency also can induce some kind of lesions on the ocular optic nerve that is mimic as a normal tension glaucoma. Here is a family. It's something very special. This is the patient's the father. He diagnosed as the normal tension glaucoma. In the 1 year's follow-up, we never found his intraocular pressure beyond the 21 millimeter accuracy. So finally, he got the diagnosis of the normal tension glaucoma. But something is very strange. His son has a same BMI, even have a same height, weight as his father. But he also suffered from the glaucoma, but his intraocular pressure is above the 21 millimeter accuracy. He finally diagnosed as a high pressure open angle glaucoma. So this is questions in one family why the phenotype of the normal tension glaucoma is different. Both of them share the same mutations, but the phenotype is quite different. So there are still some mysterious we still don't know. In the recent years, we got the new information from the prospective study and the retrospective studies. We found that the normal tension glaucoma, about the 60 to 70% of the normal tension glaucoma has a relatively lower intracranial pressures. Maybe it's not because the intraocular pressure, it's because the translaminar curvosus pressures difference cause the damage on the optic nerve. And also we get a very strong evidence from the monkeys study. After the reduced intracranial pressures, the monkeys suffer from the glaucoma-induced optic neuropathies. And even the intraocular pressures increase or decrease of the intracranial pressures can increase the translaminar curvosus pressures difference, but the different type of the translaminar curvosus increase can cause a different deformation on the optic nerve or the laminar curvosus. The higher pressures easily cause the deformation of the lamina corposa, but for the lower intracranial pressures cause the translaminar corposa increase can reduce the axons transportations, but it's a little slight deformation on the lamina corposa. And the animal studies also show in the mouse, after decrease the intracranial pressures, we can find the axons transportations was severely influenced by the translaminar corposa pressures increase. And recently we found the translaminar corposa pressures increase not just cause the damage, the influence on the axons transportations, but also can influence the blood perfusions on the optic nerve, and especially in the lamina corposa regions. And from the recently clinical observational studies, we found the acute decrease of the intracranial pressures can dramatically reduce the thickness of the corridor's tissue. There is a very strong evidence from the European study. From these studies, is one kind of procedures to reduce the intracranial pressures to treat the normal pressures hydrocephalus. After the treatment, some patients suffer from the lower intracranial pressures, and after 10 years follow-up, this study found almost 50% of the patients suffer from the normal tension glaucoma. This is direct, strong evidence support the lower intracranial pressures also can cause the normal tension glaucoma. Recently, we conducted the clinical studies. We chose the asymmetric normal tension glaucoma for the study. Finally, we found the very interesting phenomena. In the eye, keep the stable eye, most of the eye have the defect on the lamina corposa. Even there are the penetrations between the eye and the subarachnoid space. Maybe this can make the balance, to balance the lamina corposa pressures difference, can have some kind of a protective effect on the stable eye. So we make the animal studies. We make the hole on the lamina corposa area to make the penetration between the eye, the vitreous cavity, and the subarachnoid space. Finally, the monkey's translaminar corposa pressures difference really balanced, and maybe can have some kind of potential therapy strategies for the future treatment of the normal tension glaucoma. So here is my summary. The lower intracranial pressures is one of the risk factors, but that is not in all of the normal tension glaucoma patients. So to rebalance the translaminar corposa pressures difference for the normal tension glaucoma, maybe it's the one of the potential strategy of the treatment for normal tension glaucoma. So we look for the method, the drugs, the medicines, technique to increase the intracranial pressures for normal tension glaucoma, which have a low intracranial pressures patients. Now I would like to move my talk to the systemic abnormalities and the normal tension glaucoma. So there is many evidence from the studies shows normal tangent glaucoma usually have a lower BMI, and the increased BMI can have some potential protective effect on the normal tangent glaucoma. And also some studies show the estrogen decreased maybe is one of the risk factors for the progressions of the normal tangent glaucoma. And Flamm syndromes is significantly more often among the normal tangent glaucoma. Maybe there are some relations between the Flamm syndromes and the normal tangent glaucoma. And from our study, we found the normal tangent glaucoma patients usually have some abnormalities, microvesical dysfunctions by using the NAFORD microvesical detection technique. So most of the researchers focus on the gene mutations, want to see the normal tangent glaucoma and high pressure glaucoma, whether has the different gene mutation. Maybe it's because the different gene mutations cause a different phenomena of the open-angle glaucoma. Unfortunately, so far we did not find the significant difference the mutations between the normal tangent glaucoma and the high pressure glaucoma. Misleading mutations most related to the high pressure open angle glaucoma, and optineurin may be strongly related to the normal tangent glaucoma. But what is the mechanism of the gene mutations cause the signal transductions and cause a different clinical phenomena? So far, it is still unclear. Here is some studies about the optineurin. It is likely it's principally to the normal tangent glaucoma and localized partially to the Golgi's apparatus in the retina ganglia cells 5 cells. Now, finally, I would like to make a summary. For the glaucoma, the terms of the glaucoma is just like umbrellas. There is so many different types of glaucoma on this big umbrella. But for the open angle glaucoma, maybe also is umbrellas. In this under the umbrellas, there's a different subtype of the open angle glaucoma. So far, we just know the normal tangent glaucoma and the high pressure glaucoma. Maybe with the increase of the studies, we can find some more specific subtype of the open angle glaucoma. So maybe we need some new classifications for the open angle glaucoma. The more and more authors propose some kind of opinions, think that just the intraocular pressures is just risk factors. But what is the other risk factors strongly related to the normal tangent glaucoma? We still don't know. So we need to distinguish and to find the new risk factors for the different types of the open angle glaucoma. For treatment, so we just not to consider the ocular risk factors, and we should move over the focus on the systemic abnormalities, and to not just to treat the pressures, we also should treat other we already know the risk factors. There is over publications, and we still work on the normal tangent glaucoma normal tangent glaucoma really is one kind of very difficult to understand the disease, and also it's a big challenges in the global, in the whole global, especially in the Asia and East Asia. So today my talk just give us some information from our study group and from the others study from the global, and we hope we will focus on the normal tangent glaucoma to find the new risk factors, to discover the new techniques for the normal tangent glaucoma detect and treatment. Finally, thanks every members of our study teams, because our team's contribution, we got some new ideas and new information about the normal tangent glaucoma. For the normal tangent glaucoma research, with still a long way to go, we have to do our best to find the new information for the normal tangent glaucoma treatment. Thank you again. Thank you for your attentions.